Hi, everyone. Today we are meeting to discuss John's communication needs and develop a plan to support his hearing and listening goals. So, John is a 50-year-old male who recently received a diagnosis of bilateral high frequency hearing loss, which is consistent with age-related hearing loss, also known as presbycusis. I know that before receiving his diagnosis, John began noticing that conversations were becoming more difficult, especially in environments with a lot of background noise, such as restaurants or crowded social settings. And I also know that he noticed that he was turning up the volume on the television more frequently and asking others to repeat themselves more often. And after encouragement from his family, John completed a hearing evaluation with an audiologist. The evaluation showed hearing loss in both ears, and hearing aids were recommended. Although John was initially unsure about hearing aids, he decided to move forward after discussing the benefits with the audiologist and his family. So I know John was fitted with bilateral behind the ear hearing aids and is now working with a speech language pathologist to improve his listening skills and communication effectiveness. Today, we want to talk through everyone's role in supporting John, explain the recommended treatment approach, and discuss goals for improving communication in everyday situations. So, John, before we talk about treatment, we would like to hear more about your experience. What made you realize that your hearing was becoming a concern?
I started noticing it mostly when I was around other people. If I was having a conversation one-on-one in a quiet place, I could usually follow along, but once there was background noise, I really struggled. Restaurants were probably the biggest challenge because I could hear that people were talking, but it was difficult to understand exactly what they were saying. I also noticed I was turning the TV up louder than before and asking my family to repeat themselves. At first, I thought maybe people were just mumbling, but eventually I realized it was happening more often.
From our perspective, we noticed that John was missing parts of conversations or sometimes responding to something different than what was being discussed. We did not want him to feel left out or frustrated, so we encouraged him to go get his hearing checked.
I appreciated that support, but I was honestly hesitant. I think part of me did not want to admit I was having hearing difficulties, and I was also worried about wearing the hearing aids and whether people would notice them. I did not want my hearing loss to change how people viewed me.
John, those concerns are very understandable, and many people have similar feelings when they first begin considering hearing aids. During your hearing evaluation, we found that you have bilateral high frequency hearing loss. This type of hearing loss can make speech less clear, especially because many of the sounds that help us tell words apart occur in the higher frequencies. Based on your hearing results and the difficulties you were experiencing, we recommend bilateral behind the ear hearing aids. These hearing aids help provide access to sounds that you were missing and can make speech easier to hear.
I have noticed a difference since getting them. I feel like I hear more around me and conversations are easier when I am in quieter places. The biggest challenge is still when I am somewhere loud.
That is actually very common. Hearing aids are extremely helpful, but they did not completely restore hearing back to the way it was before hearing loss. They improve access to speech, but situations with competing sounds can still be challenging because your brain has to separate the speaker's voice from the background noise. That is why adding auditory rehabilitation with the speech language pathologist is the next step. The goal is to help you develop strategies and skills that allow you to use the information you are receiving from your hearing aids more effectively.
John, our treatment will focus on helping you feel more confident communicating in the situations that are important to you. Research shows that hearing aids alone may not fully address communication difficulties, especially in noisy environments. Because of this, our plan is to combine aid use with auditory rehabilitation. So, the first part of treatment will focus on auditory training, and this will help improve your ability to understand speech in different listening environments. We will begin with activities that are more controlled, such as listening to words, sentences, and conversations in quiet settings. And as your skills improve, we will introduce more challenging situations with background noise to better reflect real life conversations.
I think that would be helpful because I feel like my biggest issue is not necessarily hearing sound. It is figuring out what someone is saying when there are a lot of other sounds happening.
Exactly. We want you to help your brain become more efficient at processing speech, especially in those more challenging situations. The second part of your therapy will focus on communication strategies. These are techniques you can use to make conversations easier and prevent frustration when communication breakdowns happen. Some strategies we will practice include asking someone to repeat or reword information, letting others know when you need clarification, asking communication partners to face you while speaking, reducing background noise when possible, sitting closer to the person speaking, and choosing quieter areas during social activities.
I think asking people to repeat themselves is something I need to work on. Sometimes I miss something, but I do not want to keep interrupting the conversation, so I just pretend that I understood.
That is a very common experience. Part of our goal is helping you feel comfortable advocating for yourself. Asking for clarification is not a burden, it is an effective communication strategy.
I think that would really help because sometimes we want to support John, but we are not always sure what we should do. Are there things we can change when we are talking with him?
Absolutely. Family involvement is an important part of treatment. Some helpful strategies include getting John's attention before speaking, facing him during conversations, reducing background noise, speaking clearly at a normal pace, and allowing him extra time to process information.
That makes sense. I think sometimes our instinct is just to repeat something louder, but we want to make sure that we are actually making communication easier for John.
I appreciate that because I do not want my family to feel like they have to change everything for me. I want to learn strategies that help me be more independent and comfortable communicating.
Another important part of treatment will include education and counseling. We will discuss how hearing loss affects communication, how to get the most benefit from your hearing aids, and what expectations are realistic. We will work on becoming comfortable with consistent hearing aid use, managing difficult listening environments, and continuing to communicate your needs to others.
I will continue to support you with your hearing aids by helping with maintenance, troubleshooting, and making adjustments if needed. Continued follow up is important to make sure your hearing aids continue meeting your communication needs.
It helps knowing that hearing aids are not supposed to fix everything immediately. I think I originally thought that once I got them, I would hear normally again. Understanding that there are strategies I can learn makes me feel more prepared.
Based on your concerns, our goals will focus on improving your ability to understand conversations across different environments and helping you become more independent using communication strategies. So, our long-term goals for you are to improve functional listening comprehension while using your hearing aids and strategies, and independently using communication strategies to repair breakdowns and participate more fully in family, social, and work settings. So, some short-term goals will include understanding conversational speech with background noise, improving listening comprehension while wearing your hearing aids, identifying strategies to manage communication challenges, and using repair strategies such as requesting repetition or clarification.
Those goals really match what we have seen. We want John to feel comfortable participating in conversations and not avoid activities because he is worried about missing information.
That is my biggest goal too. I want to be able to go out with friends, spend time with my family, and not constantly worry about whether I heard everything correctly.
Because you are already using your hearing aids and are motivated to improve, you have a positive outlook. With continued practice and support, you should continue making progress.
We're excited to work with you, John. By combining hearing aid use, auditory training, communication strategies, and support from your family, we can help you feel more confident and successful in everyday communication.